The treatment approach for cervical cancer depends on several factors, including the stage of the cancer, the patient's overall health, and their individual preferences. Each case is unique, and the medical team works closely with the patient to determine the most effective strategy. Treatment options may include surgery, radiation therapy, chemotherapy, or, a combination of these modalities. The choice of treatment is influenced by the specific characteristics of the cancer and the patient's personal circumstances. Surgery, often the primary treatment for early-stage cervical cancer, may involve removing the tumor, the cervix, known as a trachelectomy, or the entire uterus, which is called a hysterectomy. The type of surgery performed depends on how far the cancer has spread and the patient's desire to preserve fertility. The extent of surgery depends on the size and location of the tumor. Advanced imaging techniques help surgeons plan the procedure with precision. Radiation therapy uses high-energy rays to kill cancer cells. It is a common treatment for cervical cancer, especially in cases where surgery is not an option. It can be delivered externally, using a machine outside the body, or internally, using implants placed near the tumor. This internal method is known as brachytherapy. Chemotherapy uses drugs to kill cancer cells. It is often used in conjunction with other treatments to enhance their effectiveness. It can be administered intravenously or orally, and is often used in combination with surgery or radiation therapy. The goal is to target cancer cells throughout the body. The choice of treatment and the specific combination of therapies are tailored to each patient's unique situation, ensuring the best possible outcome. The medical team continuously monitors the patient's progress and adjusts the treatment plan as needed to achieve the best results. Section 6. Prevention is the best cure. Safeguarding your health. Preventing cervical cancer is a multifaceted approach that involves vaccination, regular screenings, and adopting healthy lifestyle choices. By taking proactive measures, women can significantly reduce their risk of developing this potentially life-threatening disease. Vaccination against HPV, the virus responsible for most cervical cancer cases, is a crucial preventive step. The HPV vaccine is highly effective in preventing infection with the HPV types that cause most cervical cancers. Regular cervical cancer screenings, including Pap tests and HPV tests, are essential for detecting precancerous changes in the cervix, allowing for early intervention and treatment. Adopting a healthy lifestyle, including quitting smoking, maintaining a healthy weight, and practicing safe sex, can further reduce the risk of developing cervical cancer. Section 7. The importance of vaccination. Vaccination against HPV is a cornerstone of cervical cancer prevention. The HPV vaccine targets specific strains of the human papillomavirus, a common sexually transmitted infection, that are strongly linked to the development of cervical cancer. By introducing harmless fragments of the virus into the body, the vaccine stimulates the immune system to produce antibodies that can recognize and neutralize the actual virus if encountered later in life. This preemptive strike effectively prevents the virus from establishing a persistent infection in the cervix, thus reducing the risk of cellular changes that could lead to cancer. The HPV vaccine is most effective when administered before the onset of sexual activity, ideally during adolescence. However, it is also recommended for young adults who may have missed the initial vaccination window. Section 8. Living with cervical cancer. Support and resources. A diagnosis of cervical cancer can be overwhelming, both physically and emotionally. Navigating the journey requires not only medical expertise, but also a strong support system and access to reliable resources. Support groups and online communities provide a platform for women with cervical cancer to connect with others who understand their experiences, share coping mechanisms, and offer encouragement. Mental health professionals, including therapists and counselors, specialize in helping individuals cope with the emotional distress associated with a cancer diagnosis. They provide a safe and confidential space to explore feelings, manage anxiety, and develop healthy coping mechanisms. Organizations like the American Cancer Society and the National Cancer Institute offer a wealth of information about cervical cancer, including treatment options, clinical trials, and financial assistance programs. threat to women's health.